สวัสดีค่ะท่านผู้ชมที่รับชมผ่านทาง Facebook ของสำนักงานคณะกรรมการสุขภาพแห่งชาตินะคะวันนี้ทางสช.ขอเรียนเชิญท่านเข้าสู่กิจกรรมสุดท้ายของเวทีสมัชชาสุขภาพแห่งชาตินะครับจะเป็นการประชุมที่ชื่อว่าImportance of Multi-Sectoral Collaboration in Times of Covid-19 นะคะซึ่งวันนี้จะเป็นการประชุมออนไลน์กิจกรรมสุดท้ายนะคะโดยมีวิทยากรจากหลายประเทศด้วยกันนะคะเช่นดร.จัสติน คูนินนะคะจากออสเตรเลียนะคะจะมาในนามของภาคประชาสังคมนะคะดร.แอนนา สตีเวนสันนะคะจากประเทศนิวซีแลนด์จะมาในนามของภาควิชาการนะคะดร.โจราชเมตนะคะจาก WHO Headquarter นะคะแล้วก็จะมีการนำเสนอโดยดร.คณัง คันทมัทุรพจน์นะคะจากมหาวิทยาลัยมหิดลนะคะแล้วก็จะดำเนินรายการโดยน้องนริษานะคะจากเครือข่ายสมาพันธ์นิสิตนักศึกษาแห่งประเทศนักศึกษาแพทย์แห่งประเทศไทยนะคะแล้วก็กล่าวปิดโดยท่านอาจารย์หมอวีรศักดิ์นะคะรองเลขาธิการคณะกรรมการสุขภาพแห่งชาตินะคะแล้วก็ขาดไปไม่ได้นะคะก็จะเป็นท่านวิทยากรดร.วลัยพรพัชรนฤมลนะคะจากกระทรวงสาธารณสุขและผู้แทนภาคธุรกิจนะคะดร.สัมพันธ์ศิลปนาถค่ะก่อนที่เราจะไปรับชมกันนะคะดิฉันขอเรียนเชิญคุณหมอวีรศักดิ์พุทธาศรีนะคะกล่าวถึงที่มาที่ไปของเวบินาร์ในครั้งนี้ค่ะ
ครับสวัสดีครับก็ผมคิดว่าครั้งนี้นะครับก็เป็นที่เมื่อกี้เราพูดถึงว่าเนี่ยเป็นไซด์อีเวนต์อันสุดท้ายก่อนที่จะเข้าสู่วันสมัชชาจริงนะครับตรงนี้ไม่เป็นไรนะครับอันเนี้ยจะเกี่ยวข้องกับสมัชชาของเราครั้งนี้เลยนะครับเป็นเรื่องของบทเรียนของพวกเรานะครับตอนที่โควิดมาเนี่ยพวกเราทำอะไรกันบ้างนะครับเราได้มีโอกาสเห็นการทำงานของเครือข่ายนะครับเห็นบทบาทของภาคประชาชนบทบาทของภาครัฐนะครับบทบาทของทางสุขภาพนะครับทุกคนเนี่ยเข้ามารวมตัวกันทำงานนะครับทางสช.เนี่ยเราจัดเรียกว่าเป็นการจัดเว็บบินาร์นะครับการจัดพวกนี้นะครับแลกเปลี่ยนเรียนรู้กับประเทศอื่นๆนะครับเราได้มีโอกาสดีนะครับได้เรียนรู้นะครับประสบการณ์ของประเทศอื่นๆเช่นเวียดนามเช่นบังกลาเทศพม่านะครับหรือแม้กระทั่งออสเตรเลียแล้วก็นิวซีแลนด์ด้วยนะครับเห็นการทำงานของภาคส่วนต่างๆนะครับเป็นที่น่าชื่นชมนะครับแล้วก็สอดคล้องกับภารกิจของเรานะครับไม่ว่าจะเป็นสมัชชาเราอยากเห็นความร่วมมือของภาคส่วนต่างๆนะครับครั้งนี้นะครับวันนี้ครับจะเป็นเว็บบินาร์อีกครั้งหนึ่งนะครับจะเป็นสรุปแล้วครับว่าบทบาทของภาคส่วนต่างๆนะครับที่เกี่ยวข้องโดยเฉพาะตอนที่โควิดมาเนี่ยพวกเราทำอะไรกันบ้างนะครับจริงๆแล้วเนี่ยคำว่าการสร้างการมีส่วนร่วมนะครับองค์การอนามัยโลกนะครับหรือแม้กระทั่ง SDG เนี่ยพูดว่าเป็นเรื่องที่สำคัญนะครับแต่รูปธรรมเราอาจจะไม่เคยเห็นนะครับครั้งนี้เนี่ยเราเอาตรงนี้แหละเป็นรูปธรรมจับต้องเพื่อการเรียนรู้ของพวกเรานะครับเพื่อพวกเราจะได้เดินหน้าต่อนะครับว่าครั้งหน้าจะต้องทำอะไรบ้างแล้วจะย้ำความสำคัญว่าทุกอย่างทุกส่วนนะครับเป็นเรื่องของสารพลังทำงานร่วมกันนะครับโควิดวันนี้นะครับแม้ว่าเรื่องของโรคต่างๆนี่มันอาจจะบรรเทาลงไปนะครับแต่เรายังมีเรื่องเศรษฐกิจเรื่องอะไรที่เราต้องร่วมมือกันทำต่อนะครับก็ขอให้ลองติดตามชมนะครับครั้งนี้อาจจะเป็นภาษาอังกฤษหน่อยนะครับแต่ไม่เป็นไรเพราะว่าเดี๋ยวเราค่อยมาย่อยเป็นภาษาไทยอีกครั้งหนึ่งนะครับหลังจากที่เรามีข้อสรุปแล้วนะครับก็ขอเชิญชวนนะครับว่าเรามาฟังวันนี้นะครับแล้วก็โยงไปถึงว่าวันที่16นะครับที่จะเป็นวันสมัชชาสุขภาพแห่งชาตินะครับเราจะมีมติเกี่ยวกับเรื่องนี้เลยนะครับเรื่องของบทเรียนของโควิดนะครับเน้นเรื่องของอาหารนะครับที่เป็นมตินะครับแล้วก็เน้นเรื่องของการจัดการนะครับในเรื่องของระหว่างโรคระบาดด้วยนะครับเป็น2เรื่องใหญ่ๆนะครับที่เราพยายามที่จะหาฉันทมติในครั้งนี้นะครับก็ขอเชิญชวนนะครับแล้วก็รับฟังวันนี้นะครับแล้วก็ติดตามในวันสมัชชาเราด้วย16และ17ธันวาคมนี้ครับ
ค่ะตอนนี้ในห้องประชุมออนไลน์ของเราก็พร้อมแล้วนะคะขอเรียนเชิญทุกท่านที่รับชมอยู่ตอนนี้เข้าสู่การประชุมได้เลยค่ะ
Good afternoon, everyone. Welcome to the webinar on the importance of multi-sectoral collaboration in times of COVID-19, hosted by the National Health Commission Office and the Ministry of Public Health, International Health Policy Program or IHPP.International Federation of Medical Students Associations, IFMSA Thailand, and World Health Organization. This webinar is the last webinar of the webinar series of multi-sectoral collaboration in response to COVID-19. We organize focusing on the role of each sectors, ranging from civil society, government, young generation, and health sector. For this webinar, we invite all sectors to discuss together. Furthermore, this webinar is also the part of National Health Assembly's size events. We convene the Assembly annually to propose the policy proposals to the National Health Commission, chaired by the Prime Minister. Therefore, we receive an honor from HE Mr. Anutin Chanvirakul, the Deputy Prime Minister and the Minister of Public Health, to deliver the opening remark with a video clip for this webinar. Please enjoy the video.
Distinguished participants, year 2020 is the year that all of us have experienced the unprecedented situation of COVID-19 pandemic. However, this virus cannot affect our spirit of solidarity and empathy. Thailand is the first country conducting the joint intra-action review of the public health response to COVID-19. The results show that the success factor is a stronghold of society approach. I am delighted that this side meeting is about importance of multi-sectoral collaboration in times of COVID-19 pandemic. This confirms that it is not only government's role to tackle COVID-19. It is actually everyone's role. Distinguished guests, building a multi-sectoral collaboration is not easy. This cannot happen just overnight. It requires long-term trust across society. The National Health Assembly is a platform to promote policy-making process for almost 2 decades. People are empowered to raise their voice for best benefit of the society. The National Health Assembly also shows the commitment of the whole society to improve quality of life. COVID will be with us for a while, despite availability of vaccines. We must use this opportunity to build back better and call for collaboration from various sectors to build a healthy society. The theme of the National Health Assembly this year is under theme Active Citizens' Power Against Health Crisis. The outcome of the Assembly will help us fight with COVID-19 together. I wish you have successful and fruitful deliberations during this important meeting. This will make a solid contribution for the multi-sectoral collaboration. Thank you.
Thank you very much. The Deputy Prime Minister mentioned the whole of society approach. In fact, it's not different from multi-sectoral collaboration, which means various sectors and stakeholders join efforts to achieve one goal. And from the previous webinar, we drew conclusions and lessons learned and came up with a synthesis report from those webinars. So the objectives of the webinar today are to hear feedback from invited panelists on the report and to hear their perspective on how to make multi-sectoral collaboration sustained after COVID-19 or for crisis in the future. And we have Dr. Kanang Kanta Mathurapot with us today. She is from Faculty of Social Science and Humanities, Mahidol University. She is a main author of the synthesis report. She will give us a summary of the result of the previous 4 webinars. And again, the presentation will start with a video followed by her presentation. Please enjoy the video. Dr. Kanang, you have the floor.
Thank you very much. I will firstly share my PowerPoint. Do you see my slide?
Yes.
Okay, thank you very much. My name is Kanang, and today I will give a presentation on a synthesis report on multi-sectoral collaboration in response to COVID-19. In December last year, China reported a cluster of cases of pneumonia in Wuhan. A novel coronavirus was identified, and it has been a year that our global community has been encountering COVID-19. The outbreak spread to more than 200 countries and killed more than 1.5 million people. This pandemic has impacted almost all dimensions of society, including health, economics, and food security. In response to the emergency like COVID-19, the key success is multi-sectoral collaboration, which means we need a range of stakeholders to work together. We need to work across sectors with a common purpose to fight against COVID and its negative impacts. Although the multi-sectoral collaboration is well accepted, the important question is that how can we maintain this collaboration during and after COVID-19? Has the National Health Commission Thailand and partners organized a webinar series entitled Multi-Sectoral Collaboration in Response to COVID-19. We conduct the first webinars with the CSO in June, followed by Young Generation in August, and Government in September. Then we had a webinar with health sectors in October. After that, Dr. Virasak, Nanut, and I, we worked together to synthesize the result of these 4 webinars, and then we draft the synthesis report. And this is a result of our synthesis. We found that in time of crisis, the organization and citizens form the partnership to respond to COVID-19. And from the webinars, we can identify 5 enabling factors and 4 challenging factors of multi-sectoral collaboration. And we will go to each factor in detail one by one. The first enabling factor is recognition of the importance of multi-sectoral collaboration. The speakers in our webinars show their good attitude to multi-sectoral collaboration. All of them mentioned that multi-sectoral collaboration is important. Also, hearing voice from all stakeholders lead to responsive policy decision-making. Since the COVID-19 has affected everybody, the top-down measures from government would not be effective without the holistic cooperation from all stakeholders. The second enabling factor is availability of resources such as personnel and finance. The devoted personnel are key success in overcoming the outbreak. For example, in Thailand, we have more than 1 million village health volunteers who work actively on COVID-19 prevention. And similar to Bangladesh, the well-trained disabled group, they work to reach out people with disabilities to prevent COVID-19. In addition, the financial support is an important factor for prompt response to the pandemic. The case of CPI, the NGO in Myanmar, show that they could not implement COVID-19 related activities without the support from the donors and the guidance from the ministries. The third enabling factor is strong commitment from the government. In the webinar with government sectors, the speakers from Thailand and Myanmar mentioned that COVID-19 is an emergency of the state, which need the officially compliance of regulation on budget and resource allocation. In the webinar with health sectors, speaker also showed the example of strong commitment from the government of New Zealand which made New Zealand very successful in dealing with COVID. And the fourth enabling factor is decision-making mechanism. This is important to avoid bureaucratic manner. The National COVID Center is set up to enable relevant officials to operate in more efficient manner to control the spread of COVID-19 and help the people. Myanmar set up 3 national committees related to COVID-19, and also Thailand established the Center for COVID-19 Situation Administration. The structure of mechanism facilitates working across sectors and stakeholders. And the last enabling factor is legislative provision. In the government sector webinars, the speakers from Thailand, Myanmar, and Bangladesh mutually agree that available legislation facilitates the implementation of COVID-19 policies. And they said that laws and regulations are effective to strengthen multi-sectoral collaboration in response to the emergency situation. And from 4 webinars, we found 4 factors that may constrain multi-sectoral collaboration. The first one is lack of participation from citizens, marginal and vulnerable groups. The speakers in the webinar with CSO clearly indicated that disabled people have limited understanding of safe practice related to their impairment. And the speaker in the webinar with youth also stated that youth voice are not recognized, even though the youth is the largest group of population in some countries. The second challenging factor is bureaucratic culture. Each government ministry has its law and regulation, and sometimes conflicting with one another. The speaker from Myanmar mentioned about the slow process due to inflexible or financial regulation. And the third challenging factor is communication barriers. Some countries like Myanmar use different language, and it is difficult to translate from one language to another language, especially when it comes to technical terms and dialects. A clear example is the translation of medical terms to lay and sign language. The speaker from youth and health sector mentioned about the limitation of some people in access to communication technology, as they do not have mobile phone, computer, or access to internet, in particular those in the rural area. And the last challenging factor is imbalance between health and other sectors. For COVID-19, health security was the top priority, but the measure to control COVID-19 affected other aspects as well. So for the recovery phase, it is important to be more balanced by considering economy and social life. And from the webinars, at least 3 lessons learned were drawn. Firstly, we learned that multi-sectoral collaboration has many benefits, such as increasing access to resources, sharing responsibilities, and strengthening ownership of activities. And secondly, keep balancing health and economic is necessary. COVID-19 proved that this health crisis also affects the economy and environment, so the recovery should not be focused solely on health. Hearing voice from all stakeholders lead to responsive policy decision-making. Thus, there is a need to conduct research on health in all policy in order to increase political accountability. And lastly, health system reform are vital to make the country ready for future unpredicted situation. This time we see that some countries could not manage COVID-19 due to weak health system, while some developing countries successfully manage COVID-19 because of strong health system. So the national health system of every country should be strengthened to be able to handle future unexpected crises. And for the conclusion of our report, the experience from case studies to tackle COVID-19 challenges is documented for flexible arrangement, The case studies across settings, cultures, and levels of development demonstrated the importance that beyond health sectors, multi-sectoral collaboration could be done. Evidence from this report is confirmed the collaboration framework and has helped to provide some clues to guide this effort to accomplish our health goal. And that's all of our synthesis, and thank you very much.
Thank you, Dr. Kanang, for setting the scene for us. The next session is the panel discussion, and it is the highlight of this webinar. We are delighted to have Ms. Narisa Limpapasawat, a medical student representing IFMSA Thailand, to moderate the session. I will hand over the floor to her. Now you have the floor, Narisa.
Thank you for the lovely introduction, Ms. Nanut. And good morning and good afternoon, panelists and audience, wherever your location may be. My name is Narisa Limpapasawat, as Ms. Nanut said, and I will be the moderator for today. But I will also be the youth representative in this discussion, and in particular for the International Federation of Medical Students Association, or IFMSA. Today, we're really lucky to have a lot of esteemed panelists with us here today. We have Dr. Gerard Schmetz, who is the Health Systems Governance Coordinator of the World Health Organization. We have Dr. Walaiporn Pacharanarumon, who is the Director of Global Health Division of the Ministry of Public Health, as well as the Director of the International Health Policy Program in the Ministry of Public Health. Third, we have Dr. Justin Kunin, who is the President of ACON, and he's here as the representative of Civil Society Engagement Mechanism, or CSEM, for the Universal Health Coverage 2030. He's also the co-chair of the WHO Social Participation Technical Network, as well as the co-chair of the SDG 3 Global Action Plan Civil Society Advisory Group, and is the civil society representative on the Health Data Collaborative Steering Committee. And fourth, we have Dr. Anna Stevenson from New Zealand, and she is a part of the Canterbury District Health Board Health in All Policies, or HIAP team, and she is here as the representative of the Global Network for Health in All Policies. And last but not least, we have Dr. Sampan Silapanat, who is the chairperson of the Commission of International Trade and Health Studies, and is also the vice president of Western Digital. So all in all, the discussion that we'll be having today hopefully will inspire the people that's listening in, and also as well as answer questions on the direction of multi-sectoral collaboration and how it's going to move forward in the future. So for the first question, with the synthesis report that Dr. Kanang has just presented, I just want to ask the panelists if they have any supplementing or supplementing ideas, or if they have something that they think is contradicting to the report based on their personal experiences and careers. And I think we'll start off with Dr. Gerard, who was the WHO Health Systems Governance Coordinator. And you are also involved in the production of the WHO Handbook on Social Participation for the UHC. So maybe you can provide a bit of a global perspective on this.
Thank you very much, Narisa. And thank you for inviting the WHO to this prestigious panel. First of all, I would like to thank the National Health Commission, the Ministry of Public Health, IFMSA, and IHPP Thailand for organizing this webinar, and also more particularly the authors of the report, in particular Dr. Kanang, Dr. Nanut, and Dr. Wirasak. Really congratulations for this first version of the report. This report calls for a whole of government and all society approach to better address pandemics and leave no one behind, particularly, and that's very important, the most vulnerable. It insists on the critical role of leaders, the charisma, but also the need for dedicated staff, a legal environment, and also financial resources. Above all, it explains that to be effective, pre-established mechanisms like the National Health Assembly in Thailand are essential to bring together the different parts of the society. It says that it is vital. it also balances well the health and the economy and insists on strengthening health system as a foundation for better address pandemics like COVID-19. This COVID-19 crisis has shown the need to build trust in government institutions. Meaningful engagement with the public is at the core of a responsive and people-centered health system. So the dialogue with civil society organizations, NGOs, international and national, the youth, government, and the private sector is key to address this, as the Deputy Prime Minister said in his introduction. I like a lot that the report mentions the different challenges in a very fair way. For example, the youth or the civil society that are not always well represented in these platforms, but also not always recognized or engaged. This needs to be addressed. It also underlined that the bureaucracy may impede the implementation. This needs also to be addressed because building trust and confidence is not only about dialogue, about speaking, but it is also about concrete actions, operations, and importantly, results. A missing part in the report that should be addressed certainly in the near future is the inclusion of the private sector in the dialogue and also as part of the solution in fighting any pandemic, any emergency, and in particular COVID-19, as it has been demonstrated in many countries. We know that Thailand and the National Health Assembly are working on inclusion of the private sector for years, and this is certainly a good example that should be followed everywhere. The good news is that this kind of multi-sectoral platforms that have been developed in the framework of COVID-19 represent an excellent investment and have proven that it can work. So we really recommend to sustain these kind of platforms to make sure that these kind of discussions, inclusive discussions, can continue in countries to find good solutions for other main challenges like climate change, aging, or other challenges that the country face. You mentioned the handbook on social participation. Indeed, it will be launched tomorrow in WHO, Geneva. And for information, one of the panelists will be our colleague, Dr. Suit, who is also one of the pioneers of the National Health Assembly. So we all invite you to this event tomorrow. This document gives a good guidance on the complexity of engaging with population, communities, and civil society during national health policy process. And it links also to another handbook that is strategizing health in the 21st century. Finally, I mentioned the private sector, and I recommend also another WHO document that has been published recently on engaging with the private health service sector, the private health service providers, and this is extremely important to address a COVID-19 pandemic. Thank you very much.
Thank you, Dr. Gerard. Next, speaking of trust in governmental institutions, we know that any national effort would be hard-pressed to be effective without governmental support and involvement. So I would like to next go to Dr. Walaipon, and maybe you can give us some input on in the ministry level of things, and maybe drawing from your experience with Thailand's experience working with other international bodies, and perhaps some points from the Joint Intra-Action Review on Thailand's COVID-19 response.
Thank you very much for the introduction. First of all, congratulate to the National Health Commission Office and the team for conducting the webinar series and come to this webinar that is very important. Refer to the IAR Intra-Action Review that our Deputy Prime Minister and Minister of Public Health mentioned in his opening remarks. This is one example of multi-sectoral collaboration. It is not only within Thailand but also with international community. You can see on the 16 external experts made a recommendation, as well as the policy makers and the people at the operational level. They identify 6 factors. Could you go down a little bit in order to see at the middle of this paper? Go down a little bit for the 6 key success factor. First thing first is very strong leadership. The leaders are informed by the best available scientific evidence. We highlight it again, the best available scientific evidence, because we know that the COVID-19 is very new and many things we don't have its scientific evidence at this moment. But we try to do our best. The second success factor is the strong and well-resourced and inclusive medical and public health system. I would like to highlight a little bit on this. It is not only one day. It is a long-term investment by the government on medical and public health system in Thailand. And then we urge many countries to invest in the long run. The third factor is on the consistent and transparent communication, which leading to compliance of the public and protective measures. This is very important for the consistent and transparent communication, because COVID-19 can make the society panic, very panic, and then the consistent and transparent communication by one single source, as Thailand did by SKB, and we have the spokesperson who consistently show on the screen on the television every day at 11 a.m. every day, to inform the public on what is going on in Thailand and what measure we will apply. This is very important. The good communication will get involvement by many people, not only the private sector but also ordinary people in Thailand as well. Go to the right hand side. The fourth factor, administrative system. This is also another good system in Thailand that we have implementing capacity within the public and the society of Thailand. Previous experience with major infectious disease outbreak, including SARS, avian influenza, H1N1, and also other disasters like tsunami and big flooding in Thailand. Those are the experience that Thailand get involved and learn from the lesson of those disaster and public health emergency. The last factor is on the whole of society approach. This is also very important. It is not only civil society or private sector or academia or the NGO, but include everyone on the Thai soil. Because the coordination, the cooperation by everyone on the Thai soil is very important to prevent and control COVID-19. We have 100% campaign, or the campaign on 100% mask wearing, and the Thai people comply with this campaign. You can see that many Thai people stick on the 100% wearing masks without asking the reason. In addition, when the people wearing masks, we found that respiratory tract infectious disease also decreased significantly. This is another spillover effect of wearing masks. So for the report, this is very comprehensive report. The report synthesized by and presented by Dr. Kanang. But I would like to add 3 points if we can have more clearer issue. First thing first is the level of collaboration. There are so many levels. If we would like to engage the people in decision making, this is not easy. For the decision making, we need to have a representative from civil society or from constituency. And then if we can identify clearer on which level of collaboration by whom, we can distinguish as decision making level. at the operational level, and also the cooperation by all people in Thailand, that we need their collaboration. That is the first thing that I would like to suggest to clearly identify in the synthesis report. The second thing is on the private sector that Gerard mentioned. Maybe we have several examples of the collaboration with the private sector. For example, the company who produce PPE. During the first few months in Thailand, we cannot produce PPE ourselves, but the private company, the private industry cooperate with the government to produce PPE and distribute throughout the country. This is another example. At this moment, one good example is on COVID vaccine, that we have the collaboration with Siam Cement Group and also the Siam Biosci company to produce the vaccine for Thailand, the Thai people, and also to export to other countries in ASEAN as well. The collaboration from the ordinary people that could be highlighted in the report and emphasize that it is another factor for effective prevention and control COVID-19 in Thailand. These are the three things that I would like to mention. If we can put more in the report, it will make the report more colorful and attractive. Thank you very much.
Thank you so much, Dr. Walaiporn. That was very insightful, and I'm sure it could go a long way in making the report a lot more comprehensive. Next, I would like to go to Dr. Justin. You are a representative of the civil society engagement mechanism for the Universal Health Coverage 2030, which operates on the basis of leaving no one behind. This organization, the civil society, is arguably the voice of the people. So is there anything that you could contribute to this report, maybe drawing from a survey that you did earlier this year on civil society participation in the COVID-19 response?
Thanks, Narissa. Hi, everyone from Sydney. The first thing I want to say is, as Dr. Schmetzer said, congratulations, because this is a fine piece of work. And Thailand is showing fine leadership in particular, in this case, the engagement of civil society, but multi-sectoral collaboration more broadly. I agree with the analysis of the enablers of multi-sectoral collaboration and also some of the barriers. I guess the point that what I want to make is that those enablers don't exist in many places in the world, and what happens in Thailand is not what's happening around the world. And so to your point, Narissa, CSEM, the Civil Society Engagement Mechanism of UHC 2030, in the early stages of the COVID pandemic in April, conducted a rapid-fire survey of civil society organizations in about 60 countries. We had about 200 responses in 48 hours. And the majority said they had not been included in government responses to COVID. And that to the extent that they were included, those responses were more coherent and more integrated. So, and I think as a consequence of that, we've seen countries that have success in COVID responses and those that have less. And it's no surprise that the countries which are engaging their citizens and the people who live there, also non-citizens, are doing better precisely because those civil society organizations and communities have best access to the people who are most liable to be left behind. That CSEM survey that I'm talking about was incorporated into an article in British Medical Journal Global Health, which was co-authored CSEM alongside members of the Health Systems Governance Network, which Gerard Schmetz leads. I'm happy to post a link to that article because we also surveyed the COVID-19 task forces from 24 countries. And what we found there is that really those task forces were mostly scientists. They were virologists, epidemiologists, mathematicians. There weren't many people who could speak to the secondary effects of the virus and of lockdowns, people who could speak to mental health, child health, chronic diseases, gerontology, never mind non-health spheres, and very few civil society representatives at all. And so happy to post the link to that article, but it attracted the attention of WHO leadership, including Dr. Tedros. And following this work, we've had some very successful a series of webinars with Dr. Tedros and his leadership team, at which we've emphasized the importance of social accountability and the role of communities in the response to the COVID pandemic, but also beyond it. It's really difficult to create these links between civil society and other sectors in the middle of a pandemic, and that's why we need to institutionalize these processes. So that's what the Social Participation Technical Network, which Dr. Schmetz mentioned, is doing. That's what the Handbook for Social Participation in UHC is doing, and I'd really encourage you to all join us tomorrow night. Not only will you have Dr. Suet, but I will be your moderator, so if you have any questions you'd like me to ask him, please let me know what they are. And I know that many of you were involved in the production of this manual, so I want to thank Nanut, Dr. Kanang, Dr. Wirasak, of course Dr. Suet. Thailand really is a leader, and what I would urge is that Thailand continues to show that leadership in global fora. So thank you, and I have some more detailed comments, but we'll come back to them later. Thanks.
Thank you, Dr. Justin. Next, we'll go to your neighbor across the pond. We'll have Dr. Anna next. So, with New Zealand is obviously an exemplary role model in terms of their COVID-19 response. And this would not be possible without strong leadership that your Prime Minister, Jacinda Ardern, has shown. Her ability to unite all sectors of society with a common goal of tackling the pandemic has made your country obviously out of the hot water before everyone else. And so what can you say about New Zealand? What is New Zealand, in your opinion, doing right, and what can other countries do a bit more of that you can perhaps contribute to the synthesis report? I can't wait. Maybe I have to unmute.
I wanted to echo what others have said about admiring the leadership of Thailand in organising the series of webinars and in your very long history of civil society input into your legislation and your public policy work in your country. And you have been a role model for us here in New Zealand over many years, and so we're really we feel really honoured to be invited to speak to you and with you. And to your question, I don't think that everything that we've done in New Zealand has been perfect by any means, and we've had lots of natural advantages like being an island that have made things a little bit easier for us. But one of the things that I think has been very important is that COVID-19 has been a lens for action, and it has been a catalyst for action. And we have put our action into many of the determinants of health, what we all understand to be the social determinants of health. So in the webinar that I was involved in previously, I spoke about the huge focus on making sure that there were no people who were homeless in the time of our national lockdown. And we were able somehow to get everybody homed one way or another for that period. And there has been an ongoing focus on that. And so our numbers of homeless people are dramatically reduced from when they were before lockdown. We had a really big focus on digital enablement for students so that our education of our young people was able to continue throughout that lockdown period and afterwards. A lot of money was spent on devices for people who had not previously been able to afford those kind of things, and so were locked out of the whole digital educational world. Those are just two examples of the way that we used COVID-19 as the lens, as the rationale, as the reason to act on the wider social determinants of health. And in terms of the synthesis report, I think that there are two things that I would like to see strengthened in the report. They are mentioned, but perhaps not as strongly as I would like. And one is the area of the social determinants of health, the broader reasons why people become unwell or stay healthy. When we think about the big risk factors for individuals who become very unwell with COVID-19, apart from age, which we can't really do very much about, Many of the other risk factors are the same as those for non-communicable diseases, obesity, type 2 diabetes, alcohol abuse, high blood pressure, those kind of things which we are all very familiar with. And they are the things that we can't lose focus on. So in this report and in much of our response globally, we have been very focused on the way that hospitals, the healthcare system, can treat people who have COVID-19. And I would like us to be putting more emphasis onto how we can act to keep people well on the broader social determinants of health. So that is something I would like to see strengthened in this report. And the other area that I think is critical, that is just glanced over in this report, is the issue of climate change and the environmental impacts, which is perhaps the biggest determinant of health of all. And we know that diseases like COVID-19 there will be more of them as the impacts of climate change become more noticeable, I guess, to us, and that they will be harder to manage as we have more and more major climate interferences, more typhoons, more fires, more glacier melting. All of those things will contribute to us globally not being able to manage these pandemics better. So I would like to see a little bit more on that. And then the final thing that I think hasn't been fully addressed in this report, and perhaps reflects that in the webinars so far, I don't think we've had any representatives from the United Kingdom or from the United States. And in those countries particularly, we see the impact, the differential impact of COVID-19 on non-white groups and on groups who have been affected by colonization over centuries. So we see the impact of centuries of institutional racism and colonization that have meant that Black people in the United States have dramatically different death rates than others, and the same is true in the United Kingdom. And that is obviously one of those big determinants of health outside of the health system, but also embedded and problematic in the health system, that we have to name, and we won't be able to address it until we name it and understand the ways it impacts on how we address all of these issues with COVID-19. So those three things are the things that I think we could really, they're already mentioned in the report, which is fantastic, but I think we could bolster them. Thank you.
Thank you. We're only as strong as our weakest link. So, yeah. So, moving forward, multi-sectoral collaboration needs to address all these other social determinants of health in order to be better prepared for not even the next pandemic, but just the next crisis, whatever it may be. And lastly, can we have Dr. Sampan, who is representative of the private sector in society nowadays, especially in countries with capitalist societies. Private sectors are arguably the main driving force for all of the nation's internal actions. So what can you contribute to this synthesis report?
All right, thank you, Kun Narisa. I think, hi everyone, good afternoon from Thailand. As representative of the private sector, I think is what I want to see in the report is the lesson learned that we are learning. I think for the private sector standpoint, since I have been working with the company for many years, and we have seen so many cases in the past 9 years ago, whenever we have flooding, I mean, that hurt the company so huge. And, you know, on along we see the political unrest, yellow shirt, red shirt in Thailand. So every time we have to form the, what we call the CMT, the crisis management team. But this time with the COVID situation, it's completely new and different from what we have been doing in the past. Okay? So I think one that I like to share is when the thing came in at the end of January, beginning of February, we are drawing what we call it what should be the guiding principle. Okay? And we are pretty clear that number one, we want to protect the people. The people in the company, for myself, Western Digital in Thailand, we have 27,000 people, you know. And no, all along we need to listen to the government, the Ministry of the Public Health. At the same time, we want to listen from corporate direction. The WHO, guideline or guidance to all of us. So every day we are talking about what should be the guiding principle from the private sector. So pretty clear that we want to protect the people. And after the people get protected, the people trust the company, the people trust the leadership. Now the people will protect the business. Okay? So with, 27,000 people, every day we working 24 hours, 7 days a week. And every day that we have more than 200 buses to bring the people in and out, day and night. So those type of thing is a new learning piece that I think it will be nice if we have some detail of those of learning in the report. Okay? So after that, we have to work with the supply chain because fortunately and unfortunately, we are the technology type of business. And our hard drive become the essential products, essential goods for the people of the whole world during the COVID because the people working at home, use a lot of online, learning online. And the storage requirement is jump up very huge at the short-term period of time. So the business become more crucial, not just only for the Thai people, but for the rest of the world. So those are the challenge that we have been learning since February, March. And with all of those, we are working on how to protect the people, how to make sure that all the people in the company at least meet the minimum requirement from the government. That's the key. So we are talking to the government with our networking connection and all of those that don't worry, we know how important it is. We will protect our people at least at the minimum requirement that the government wants. The rest of it, we're going to add on. So we instruct the people whenever they leave home, put the masks right away. In the buses, social distancing. Okay? Whenever you come to the canteen, we have data testing. For every single operator, use a mobile phone to test that where are you during that period of time in case of anything happen. And the BCP coming in place with the 4 phases in terms of recovery, response, resume, everything, full phases to make sure that the people have to be safe first. When the people feel safe, feel trust, they will protect the business. So those are the things I think should be a lot of new learning, a lot of mistakes that we made. At the same time, we learn a lot from those. So that could be nice if they are included in the report. Thank you.
Thank you. So obviously the takeaway from that is in order for the private sector to be effective in the multi-sectoral collaboration, you need to be mindful of the workforce within the private sector. All right. So thank you so much for all of your inputs. I'm sure the people listening to this, whether from home or from the workplace, can and will be able to incorporate your comments and your messages in some way or the other in their fields of work. And for the next question, I want to ask just 3 panelists because we're quite limited on time. And I'll ask everyone to restrict their responses to about 3-4 minutes if that's okay. So the question is, it is evident from the synthesis report that a governmental lead is crucial in not only initiating, but also uniting a multi-sectoral collaboration. However, we've seen examples all over the world, not only just this year, but in years past, that some governments fail to recognize the urgency and the significance of some crisis, and this resulted in them not being able to generate a timely and appropriate response to those crises. So how could you, which are the other sectors in society, step up and create an effective multi-sectoral collaboration in spite of perhaps the lack of support and initiative from the government? Can I start off with Dr. Gerard on this?
Yeah, thank you very much, Narissa. Yes, we know from your webinars and also from recent governance papers and debates that social participation mechanisms are key to involve providers, government, and beneficiaries in development of strategies that actually lead to strengthening health systems towards universal health coverage. So, when we think of this mechanism, I think there is a recognition that they are key, they are essentials. Multi-sectoral collaboration is essential, but unfortunately, they are not in place everywhere. Mm-hmm. And I think that Dr. Justine Kuenen very well underlined it with the results of the survey. And very often it's because of shocks, like COVID-19, of course, but also for example, the Arab Spring revolutions 10 years ago that push governments to put this kind of mechanism in place. So in a way, we are often too late because they do not exist. And creating this participatory culture takes time. It is quite hard to establish it in an emergency mode. Mm. So I think that and we have seen this also in COVID-19, if the government is not ready, if the national government is not ready, very often it's a local level that is taking over these capacities. And at local level, village, city, province, we may have a creation of this dialogue to find local solutions to local problems. Initiatives can also be taken by the civil society and the providers' associations and the youth and others like in these webinars. And this initiative can push governments to institutionalize this kind of platforms. I think I would like to say one thing on that, is that to have a platform is one thing, to maintain the platform is another one. I think that Thailand with National Health Assembly has demonstrated that it can be sustained, but of course, in Thailand, you have a renewed agenda. I have the chance to follow the National Health Assembly in Thailand, and every year there are new topics. And certainly, like Anne and others said, climate change, aging, and other issues can be good topics to institutionalize these platforms. But importantly also, when these platforms are created, it's very important to embed it into the national planning process. It's not only about discussing what we could do, but it's also about assessing if what we do is going in the right direction, monitoring and evaluate if the actions are done collectively. So we need to find a good reason for the platform to make the best out of it. Thank you very much.
Thank you. So obviously, in order to be better equipped to deal with the next crisis or pandemic, we need to create more platforms and be able to sustain them to further promote collaboration and cooperation between multiple sectors, even if that means sort of like bypassing the government if they're not totally helpful. Okay. Yeah. Okay, so next, can we go to Dr. Justin? Because I think this really, really affects your line of work and, the civil society organizations, especially with the reports, the survey results earlier that mentions that most CSOs don't really think that they have been given enough opportunities by the government to provide their own input into the COVID-19 response. Is there any sort of institutionalized platforms or connections that you can create in the future to be better equipped to deal with this pandemic, even without the governmental help and support?
I mean, thank you, Narissa. I think the first point is to acknowledge that government political support really is very important. And though while the network that created this handbook for social participation on UHC called itself the Social Participation Technical Network, we probably should have called ourselves the Social Participation Political Network, because often governments don't allow participation, not because they don't know how to do it technically, but because they don't want to. And that is why we have things like the high-level meetings on universal health coverage, the State of the Commitment UHC report, which has just been released, so that there can be pressure, at least focus at a global level on these things, and also why we need to empower civil society, not just in service provision, but in advocacy, because ultimately governments are responsible to the people who live in that country. So that's an acknowledgement that, yes, political support is critical. But then the other side, and to your question, what do you do when that political support doesn't exist? Well, to be honest, that's the normal situation for civil society. And particularly when we're dealing with marginalized populations. You know, the history, I work in, ACON is the AIDS Council of New South Wales. If we think back to the HIV/AIDS epidemic, actually pandemic, the key populations who were affected were sex workers, injecting drug users, men who have sex with men, transgender people, people in prison. You know, these weren't things that governments were willing to support in most places in the world, and they continue to be populations that governments often don't really want to have much to do with. So civil society has thrived on reaching the most marginalized in the absence of government support. And often we've done that with the assistance of multilateral organizations, with the assistance of philanthropic foundations, who have been willing to provide that support, notwithstanding government resistance. Now, we hope that could change, but the reality is that civic space is limited in many countries of the world. And so we will keep doing in COVID-19 what we've been doing for the last 35 years in HIV/AIDS. But we're thrilled when there are opportunities like this through the National Health Commission office in Thailand and in many other parts of the world, increasingly to engage the government, because it makes life a lot easier. Thanks.
Great. And lastly, for this question, can we have Dr. Sampan on this?
Yeah, when it comes to the collaboration, this is what I can share. During the COVID time, I become the member at least 2 commission. I think the strength of the commission is how to get effective collaboration. And you have to choose who is the right partner and right player in the role. So whenever anyone, let's say we're talking about the political supporting, when some party is weak in supporting, the rest of the collaborative team will create the peer pressures to the person. And I think in the last 2 commissions that I have been working with, I think we see the balancing and the trust among the membership. I think the keyword is the trust. I think it's good to mention about this question. And from this report, at the end of the game, or even today, we already, in the COVID situation for almost 10 months, I think we can learn a lot from the country that have pretty good in the participation and support, and we can learn from some of not good country. I think include in the report. So back to those things, I think is to be fair, pick the right person, pick the right partner, the right group in the sense, and create some peer pressure inside. But one last thing that I want to mention, I see a lot of commission fail also in the country. Don't just look at the country and the government by you keep on asking the money from them. I see a lot of commission when come to the bottom line action plan and where gonna find the sort of fund, who gonna give us the money. So everyone heading to the government and government and government. I think our mindset have to be changed that among the partner, who should be the best partner to contribute the resources.
Thank you. So to take away from what everyone's just said, all of the sectors can create their own impact. It doesn't have to be just led by the government, although that would be very effective, if the government were to spearhead efforts to do anything. But all of the other sectors can also generate their own impact. But it's best to get talking and get to know each other and get to know your standpoints on a particular issue. And so you can, I guess, come up with a compromise that would go forward in becoming an effort to help alleviate the situation. All right, so for the third question, I would like to ask Dr. Anna, Dr. Walaipon, and Dr. Gerard again. So what would the face of multi-sectoral collaboration look like when the health of the population is not the top priority like it is now in the times of COVID-19? And so because in normal situations, perhaps economic benefits would weigh a little bit more than everything else, even in the government sector or like in the private sector. And so how would this multi-sectoral collaboration look like? And from the knowledge and from the lessons that we've learned from the COVID-19, what can be changed about that? Can we please have Dr. Anna?
That's quite a big question. The things that I'm thinking about are coming back to our speaker who's focusing on the private sector. I thought his point that if you can help people to feel safe, then you generate a lot of loyalty from them, but you also enable them to act and to do things that maybe they couldn't have thought possible before. So I'm thinking about how have some of the really massive changes in our society happened, and they have often happened when governments have been completely absent or even opposed. So we're thinking about some of the big historical things like when the Berlin Wall came down, when Nelson Mandela was released from prison, and the start of the end of full apartheid in South Africa. Even more recently, the complete failure of the Copenhagen climate change talks, followed not very long later, just a couple of years, by an incredible successful collaborative agreement in Paris in 2015. And all of those events, I guess the things that they have in common are a kind of complex system, distributed network is the academic terms, I suppose, but individuals and small groups, non-government groups, civil society groups, all with a really strong focus on a particular issue, which was often about the survival of their society as a functioning unit, and the survival of individuals in it, and combined with a real hope and focus on taking action with hope and optimism for a better outcome. And somehow that happened without strong government leadership, but it happened with lots of individuals believing that their individual acts were important and would make a difference, and that they combined their individual actions with smaller groups, the civil society groups, and then they all somehow amalgamated to reach these tipping points, which led to amazing, dramatic societal changes. I don't think anybody has the recipe for how you do that, except for those ingredients of how do you sustain hope, how do you sustain optimism, how do you enable different groups to act. One of the things that has happened in New Zealand in our COVID response is in previous pandemics like this, in the 1918 influenza pandemic, for example, the indigenous people of New Zealand, the Maori people, suffered death and illness at rates up to 8 or 9 times worse than the English colonisers at the time, back in 1919. And pretty much every social statistic that we have is along the same lines, that Maori people fare very much worse than the rest of society, even now, today. And so when COVID-19 came along, there were many people who were very alarmed and saying, Maori people in New Zealand, this is a huge risk for them, things will go badly. And in fact, at the end of, well, so far, after this time, the Maori in New Zealand have actually done at least as well and perhaps slightly better than the rest of society. And there are lots of different possibilities for why that might be, but a really big one was that they were enabled to take action themselves and to decide for themselves what was the important things that they needed to focus on in their response to the pandemic. And you know, right up, some of the actions that they took, some people might have argued that they were extra legal. You know, they set up roadblocks into some of the more rural regions and prevented other people from coming into their regions. It was one of the more controversial things that happened. But they were really enabled socially as well in terms of giving aid to each other, supporting each other socially. And so that is a really up-to-date example of how individuals, small groups who are working with a common cause and given agency can make huge positive changes, and that no one ever guessed could happen. So that's kind of a roundabout answer, I think, to what you're saying, but I guess my overall answer is that it definitely can happen, and there's a lot more to be understood about how it happens.
Well, let's hope that all of the demographics in, you know, all of our countries and sectors will learn from the pandemic this time, and will be able to set long-term, like look towards the future in a more long-term basis, and that the country and especially like the government and all the other sectors can provide better outreach so that each of the marginalized populations can learn to have their own agency and protect themselves and be able to forge collaboration even in times of when there's no crisis. Okay, can we have Dr. Walaipon next? Because I think it will be very interesting to hear this from, you know, Thailand's Ministry of Public Health point of view about how maybe we can have a greater and a more intimate multi-sectoral collaboration post-COVID-19, learning from like our experiences in COVID-19, which Thailand has done so well.
Thank you. For the COVID-19, we see that the government and the whole society give higher concern on health than wealth. Because many countries decided to lock down. Even in Thailand, it's totally locked down for a month. And the economy of Thailand shut down totally during the curfew and the lockdown of the country. In some provinces, we know exactly that this province, for example, Phuket, it is a tourism area. When this province locked down, the economy of the Phuket province totally shut down, and then the people move out from that province to go back to their hometown because they cannot live in that province without wealth or economy status. And then we need to balance between health and wealth. When we can control the COVID-19 pretty successful, because we can control the new cases only from imported cases, not the local transmission. Thailand was slightly relaxed, and then the government think about travel bubble in order to boost our economy. However, it was not yet successful. We found some new cases, and then it made Thai people feel unsafe, insecure, and a little bit panic from the Egypt soldier case and many other cases. Then balancing between health and wealth with the multi-sectoral collaboration is not easy in the crisis situation, especially the new or the novel coronavirus. If it is the same experience that we had before, it might be easier. But at this moment, like Dr. Sampan said, we need to build trust. Trust by whom? By everyone on the Thai soil, as well as the outsider of Thailand. At this moment, many foreigners, for example, from migrant labor, they would like to come back to Thailand. In order to have and Thailand also have the labor shortage. So the balance, the economy balance between and among the provinces in Thailand is not easy. One thing that we need to take into account is that the pandemic or COVID-19 should not have higher disparity or inequity within the Thai society and also not among other countries as well. The rich should not be richer. The poor must not be poorer. And then the equity gap should be the highest consideration of the Thai government. Thank you.
Thank you. I think we can see here the common points between Dr. Anna's and Dr. Walaipon's response is that the different demographics in a country experience the pandemic and experience any crisis very differently. And so, and you need to think, in order to come up with effective solutions, you need to think in the shoes of the people who experience a particular experience in the crisis. And maybe this is where WHO comes in, because WHO perhaps can advocate for governments to include more civil society influence and roles into their pandemic responses, and also, more importantly, as everyone else said, to consider the disproportionate impact of the pandemic on different communities. So can we have the next response go to Dr. Gerard, please?
Yes. Thank you. Can you please repeat the last
yes.
part of your question?
Okay, so the question, wow, it's been, it's been about half an hour since I said the question. Okay, so the question is, what would the face of the multi-sectoral collaboration look like when we're out of this pandemic and when the health of the population is not a top priority, but we know that we need to maintain this multi-sectoral collaboration in even greater degrees than we did before, and the government needs to include more of civil society and the people's voice in all their responses and actions moving forward. So what do you think is the role of WHO in this, and how is this future collaboration going to look like, perhaps?
Oh. Okay. Thank you very much. I think the WHO and Dr. Justin Quinn knows it quite well, has established platforms like the UHE 2030 and pushed indeed for, at the global level, for regrouping civil society and making sure that they have a voice at the global level. This is also something that is absolutely needed at the national level. As Dr. Quinn said, we have still a lot of work to do. The good example of Thailand and other countries is not there everywhere for the moment, so we need to push for that. We need also to maintain and sustain this kind of platforms. As I said earlier, a way of doing so is to keep the platforms active, to continue to work. You don't gather people without reason. You have to bring the people together when you have a good challenge to address. COVID-19 is an example. We have many other examples. We mentioned climate change and others. But also in the routine, we need to make sure that there is a follow-up of actions. That's why I mentioned that it's so important to make these platforms, inclusive platforms, also active in the monitoring and the evaluation of progress in the health sector. And so when we say platform, inclusive platform, we mention, of course, the civil society, the representatives of the beneficiaries, the service providers, public, private, private for-profit, private not for-profit. It's critically important. Then we are in a new era. The pandemic has devastated the world economy, sorry. So we are in a situation where many governments put health very high on the agenda, a top priority. We need to make sure that universal health coverage and health security is good for the economy, and that in turn, the economy is good for health and health security. That's a positive spirit. And this kind of inclusive multi-sectoral platform need to be the engine to boost this health and economy dialogue. Why? Because usually the civil society and others, as is well explained, have also a good connection with the social sector, or the private sector has also other connections with other sectors. And this needs to be to become a reality. So multi-sectoral platforms as engines for health and economy dialogue. I would like to insist on one thing on that one, that we need to convince the government to invest in the core public health functions. What is the function of the government in terms of public health, not clinical care, but what to do in terms of boost this? One of the top public health function is indeed the social participation in health. It has been discussed everywhere, and it's time to really invest in this. There is also other public health functions that are very important, linked to the international health regulations, need to surveillance, research, control of threats, public health, regulation, enforcement capacities, and so on and so forth. Obviously, we need to have all the actors involved in this process under the leadership of governments and ministries of health, of course. But this needs to be really a top priority. And with this and multi-sectoral platform, probably we can make sure that we can address future threats in the future, as long as we keep these platforms active. Thank you.
Thank you, Dr. Gerard. So that really is a way forward in the future in order to make us better prepared for any crisis that may come. Okay, so we initially have a fourth question that touches on marginalized and vulnerable groups, but I think we've already sort of went over that with our previous question. And since we're quite short on time and we want everyone to leave a take-home message for all of the audience and everyone that is watching this right now, we're probably going to skip to taking questions from the floor now. So we have one in the chat box at the moment, which is, could we and should we measure the degree of multi-sectoral collaboration? Should we have more of it? And if so, how do we know how much is already in place? Would agreed measurement be useful? This goes to anyone who wants to answer first. Okay, Dr. Sampan, you have the floor.
As I mentioned that we need to start with choose the right partner, right person. I think the next step is I'm focusing on the R&R, role and responsibility. I think when come to the multi-sectoral type of collaboration is, I think back to the guiding principle, diversity and inclusive is number one. Collective genius is number two. I think we hear these two gimmick words so much in the social media. But we have been learning, actually the crisis of COVID is not just only one. I mean, if you move back to the 5 years ago, we have the technology disruption coming in. We are chip and chain, almost a lot of things to the technology era, right? So when COVID came to add on the top, now become more vulnerable to the whole societies. That's why I say that to look at if we pick the right partner, right roles, and inclusive, and collect all the ideas, and the most important one, the critical role, that we put the guiding principle to every members about. Try to segregate and separate between what is the facts and what is the opinion. In those type of meeting, even I'm chair the commission of the national health. I hear a lot of the people speak up, and we have to listen. But at the end of the game, we like to ask them back that it is the fact. Do you have any reference, or it's just your opinion? And we have to work pretty hard with the secretariat team to filter and sort those out and come up with the good report at the end of the game.
Okay. So collaboration, could also adversely affect the effort of the entire team if it's not factual and if it's, is that what you're trying to say?
Yes, and the most important word that I forget to mention about, you have to build the trust among the team member also, and gonna make your move in any commission or any group of the people. When come and work together with low trust, you forget it. You can't move forward. The speed gonna be very, very low until you can't move forward.
Okay, thank you. Do we have perhaps one more input? Maybe Dr. Valaipon. Yes, thank you.
Thank you. I would like to refer to the triangle that moved the mountain, that the National Health Assembly and the National Health Commission Office apply for. And it is not only for the National Health Assembly, but Thailand also apply this concept for many big reform. For example, the universal health coverage as well. Those three angles are, first thing first is the creation of the relevant knowledge. Without evidence or knowledge, it will go wrong. The civil society or the social movement might be not based on evidence. It will go like a protest. That we should not let it in that way. And then the political support, the political movement will come in and will shape everything into the decision making. With these three angles, the mountain can be moved. It means that the very challenging problem or obstacle can be solved by applying this concept, and then this could be the one thing that we can measure. Go back to the questions in the chat box. I think we have the conceptual framework for measuring the multi-sectoral collaboration, but again, it means which level of the collaboration, at the operational level or at the decision-making level. That is another important thing. And what are the impact that we expect to see from that multi-sectoral collaboration? Thank you.
Thank you. So I think from listening to you two, you can't really have too much multi-sectoral collaboration, but a quality multi-sectoral collaboration that is effective and productive has to be built based on trust and facts and evidence in order to be successful. Okay, I hope that answered your question. And so now we'll move on to the last part of our discussion, which is for the panelists to leave their key message that the audience can take home with. And if there's anyone who has to leave first for another meeting, maybe they can go first. Justin, is it? Dr.
Yeah,
Justin,
I've got a few minutes, but since I have the floor,
okay,
maybe I'll go first. So I think the takeaway message is that despite all of the challenges that we've described during this webinar and other places, the crucible of this crisis, the COVID-19 pandemic, has forced us to work together. And it's taught us, as if we didn't know it already, but now we certainly do, that the government needs community as much as the community needs government. And actually, we all need each other, whatever sector we're in. But the key question, and Dr. Walaipon, you touched on this really beautifully, is that how do we keep that momentum that's developed in this crisis going post-crisis and translating it towards UHC and towards Sustainable Development Goal 3 and the other SDGs. The partnerships that we formed and the multi-stakeholder collaboration during COVID-19 have demonstrated what's possible. But what kind of barriers, what kind of bureaucracies can be removed moving forward? And so we're in a transformative period and there's a tremendous amount of potential. But again, if we look back to the HIV/AIDS pandemic, not all multi-stakeholder partnerships endure, and what's needed is the institutional commitment, a sort of bench depth, because it's easy for systems to default into the ways they've traditionally functioned. And so really it's about institutionalization, institutionalizing social participation and accountability, and that's what is being done so well in Thailand. So once more, thank you. It's really wonderful to participate in your National Health Assembly next time, hopefully in Bangkok. Thank you.
Thank you. It's great to have you with us today, and thank you for all your inputs and everything. I'm sure they're valuable to everyone listening. Next, I think Dr. Walaipon has to leave fairly soon as well, so yeah, maybe you can go next.
Thank you very much. I think multi-sectoral collaboration seem to have the meaning of quantity. We don't have only the involvement by many people in quantity or in large number, but we need the quality. As Dr. Sampan said, we need to point out who are the right person or the right partner to join, and then the collective intellectual capacity of those partners is very crucial. And then we need to maintain, as Dr. Gerard said, need to maintain the platform. It should be sustained as well. Sustain not only in the quantity, but also turn things to be the quality of the collaboration. That is the one key message that I would like to highlight here. Thank you very much.
Thank you. It's great to have you with us today. Next, can we have Dr. Anna? I understand it's quite late for you, so maybe, yeah.
I think my key point would be about staying positive. It's really easy when you're on your own to become quite cynical and disillusioned, and it's not always easy to stay positive even when you're working with other agencies. All the barriers that are mentioned in this report can feel really overwhelming. Bureaucracy, lack of government leadership, all of those things. But I think we can choose to stay willing to engage, and we can choose to stay optimistic that change can happen. And when we are in that space ourselves, that makes it easier for people to work with us and makes it easier for us to find collaborators. So I think that there is that it is really important for us to nurture that approach in ourselves and in the agencies that we work in. So it's pretty simple in some ways, but hard in others.
Great. Thank you so much for your time, and good night soon, I guess. Can we please have Dr. Sampan next?
Yeah, just one last thing to add on. I think we established a lot of good things during the COVID time with the multi-sectoral commission and so many platforms. But one thing that I want to remind that most of the meeting or most of the gathering is do more on the reactive mode. So we need to change to be proactive more. I mean, when the COVID situation getting better, don't lose the momentum. Keep, try to gather together, even sometime the meeting with no agenda. Okay, let's come and meet and chat. Whenever you have a non-agenda meeting, actually a lot of genius and intellectuals come up in those when it come to those environment. So just only my last part to be.
Yeah, so even if, there's no agenda, these meetings can serve as like bonding time.
Exactly.
Yeah, bonding time between lots of different agencies
And you can
bodies.
enable the trust level among your members. Yeah.
Great. So can we finally wrap this up with Dr. Gerard, please?
Yes, thank you very much. Thank you for the report, because it's very courageous to develop such a report in this difficult period, because it concludes that a challenging aspect of the governance in the 21st century is to bring people voice into the policy and the decision making. I think that Thailand is at the avant-garde, but it's really something that we need to put on the table much more in the future. Again, I invite you for the launch of the Handbook on Social Participation tomorrow. But I would like also to re-insist on maybe different things that have been said. Dr. Sampan insisted on trust, and Dr. Wadapon insisted on quality. I would like also to insist on representativity. And I think that these platforms that are created should also be the custodians of the representativity of these, and to make sure that these groups that are underrepresented are also part of the dialogue. It's extremely important. It should be a top priority of the secretariat of these platforms to make sure that the right people are invited and participate to the discussions. Then on the quality, I think it's critically important, because we need to develop quality products. These people need to really participate to actions and to strategic developments that are going to make a change, because that's where it makes a lot of sense. One aspect on which we need to insist also is a readiness. We have, through this report and through the previous webinars, demonstrated that in the countries where these kind of platforms exist, pre-exist, it goes much better. So it means it's an invitation to be ready. So these platforms, we should have a big push out of this report with all governments, civil society, youth association, private sector associations, and others, to make sure that the creation of this platform in the countries where it doesn't exist are on the agenda. That's also, and I think I really agree with Dr. Sampan, that we need to have a long-standing trust relationship established among these different stakeholders. When we meet for the first time and there is an emergency, okay, we all want to work together. When we meet for the first time and there is no real emergency, we need to know each other and to build slowly this trust relationship. And this is critically important. So to conclude, let's be ready, and let's have in mind and in the recommendation of this report, the creation of these inclusive dialogue platforms. We know that they are useful and they should be pushed everywhere. Thank you very much.
Thank you so much, Dr. Gerard. So I think what we can all agree on is that we all want higher representation from all demographics, especially marginalized groups in our society, in order to better respond to future crises. And also we want these representations and connections to be institutionalized, to maintain its activeness, in order to not only just to react, but to be proactive in non-crisis times, and to create trust, basically, to be able to better equip ourselves in dealing with whatever may come in the future. And so these connections can serve as like a pre-existing mechanism for when the next issue arises. And also not only high representation and higher collaboration between sectors and demographics, but also more quality multi-sectoral collaboration. I think these are all the points that we can agree on from this webinar, and I will now thank you everyone so much for attending, panelists and audiences alike, and I would like to hand back over to Ms. Nanut for the close, to next on with the procedures. Thank you.
So I think that everyone agree that the discussion is very useful and enjoyable. And I have to thank Narisa for the moderator because this is her first time to be a moderator and she did a great job.
Thank you so much. Thank you. Thank you.
And we now come to the last sessions of the webinar. So may I invite Dr. Virasak Puttasi, Deputy Secretary General of the National Health Commission, to give the closing remark of the webinar, please.
Thank you. First of all, I would like to thank all speakers and for sharing your experience and wisdom. It's very, very interesting, with also challenging for your take-home messages. That I would to echo the opening remark from the Excellency Anutin Kanang report, the social participation, the PSO report that Gerard mentioned about. Varaiporn, Justin, Anna, Dr. Sampan from the private sector as well. We do require the multi-sectoral collaboration with the range of the multi-stakeholders across sector as well, since the COVID pandemic has negative impact to all dimensions, not only the health or healthcare services, but we struggle with the difficulties, issue of food meals, lose jobs, and of course in the interrupted of the local and national economy as well. From the evidence of the seminar webinar series that we organized in June 2020, is highly wise suggestion from speakers and active participation. I am confident that to emphasize the multi-sectoral collaboration is vital to fight the COVID-19. It has been proven that it is an effective mechanism or management tools amid the crisis. We got learn of the increasing access to resources, food sharing responsibilities, and strengthens our ownership of the activity that stakeholders at both local and national levels. I am aware that balancing of the health and wealth or economic that Varaiporn mentions is very challenging. It is demanding for the government and policy maker, not only in Thailand but around the world, before the decision of any social intervention against COVID-19. At least that intervention should be considered at least less impact on the marginal group, such as the poor, the ethnic group, disabled group, something like that, because the burden of the pandemic did not fall equally to the people across the society. However, I saw the opportunity of the COVID-19 situation make the performance of the multi-sectoral collaboration is visible now. This time, the civil societies, private, academia, and power of the younger generations occupy together the same as public health sector and government, especially for the issue of the social determinants of health that Anna mentioned on. This is important to develop the platform and dialogue to bring all together to collective actions, mobilize the social to demands, the voice concerns and wisdom that synergize working with the formal and informal sector together. That Dr. Sampan suggests how to make it happen in the sustainable way. We cannot shut our eyes on the investment of health system strengthening with the good foundations, adequate financing and social support to making our system is more resilient and be proactive engage of the people's approach in terms of the inclusive participations. For the next couple of days, on the 16th and 17th of December, we will have the 13th Thailand National Health Assembly, the social platform that we sharing and learning together among sectors and discuss what we have done during the COVID comes. I assume that to get to resolution about on the food security and management in the crisis, and also the resolution on the better organize and strengthen our health system to be more prepared and resilient to the further challenge circumstance. I would to conclude my remarks with a big thanks to all speakers and participants in the webinar. Your contribution is outstanding, not limit only to the revision of the lesson learned from the field synthesis report. I myself found that the learning from you, from experience from you all, is respect to different sector and context is very invaluable. Hopefully, we can move this agenda, making more collaborations and synergize working together in the future towards the general multi-sectoral collaboration and actions. Thank you.
Thank you very much, Dr. Virasak. I just want to inform that the final synthesis report will be soon uploaded on our website. And please stay tuned with us and feel free to share the report to your network and colleagues. And please help us improve our work by returning the evaluation form to us. And goodbye, and hope to see you in person one day. Thank you. Bye.
Thank you very much.
Thank you. Thank you.
Thank you.